Audio Jungle. Audio Jungle.
The things that I need for the assessment are oximeter, stethoscope, thermometer, the BP apparatus. Before we start the assessment, we need to do the proper hand washing first. We should provide privacy and confidentiality for the patient. Good afternoon, ma'am. You can
Good
come in.
afternoon.
Have a seat, ma'am.
Thank you.
Welcome. I am Stel, the nurse assigned for you today.
Okay.
And I want to verify, ma'am, if you are Miss Eileen Moran.
Yeah, I am.
Okay.
Eileen Moran.
What would you like to be called during the assessment, ma'am?
You can call me Mrs. Moran.
Okay, Mrs. Moran. So the reason why I'm doing this assessment is to gather all the information before the doctors comes in.
Okay.
And do you prefer in this interview to be in English or Bisaya, Miss Moran?
English is fine.
Oh, okay. If you have any concerns or clarification during the assessment, you are free to ask anytime.
Okay, thank you.
By the way, ma'am, did you come here alone or do you have somebody waiting on you?
Oh, I have somebody outside. Yeah.
Oh, okay. Also, ma'am, is the room temperature okay or do I have to cool down the...
No, this is okay. I'm fine. Thank you.
Okay. So now, ma'am, I'll start the assessment. Can I have your full name?
Irene P. Moran,
Where do you live right now, ma'am?
Catalunan Pequeño,
Your age?
67.
What is your marital status, ma'am? Are you single or married?
Widow.
Wait. Date of birth?
March 23, 1955.
What is your occupation right now, ma'am?
I am retired already.
Retired. Do you mind if I ask you, ma'am, what was your profession before?
No, I don't mind at all. I was working as a nurse before, and I'm already retired for 8-9 years now.
Okay. Mrs. Moran, may I know why are you here in our hospital for seeking care?
Last night I experienced a vertigo. It happened so sudden. It took only about few minutes, and a little bit. I was also a little bit nauseous, but it just went away after a few minutes, and I felt better. So what I did was I just had bed rest all night. But I'm here today just for I just want the doctor to check on me. I also had, by the way, nurse, I had this vertigo before, so I had a history of vertigo already. I was admitted in this hospital about 2 or 3 years ago, and I was seen by the same doctor.
What about now, ma'am? Are you feeling dizzy or nauseous?
No, I feel better now. I don't have dizziness, I don't have vertigo, I don't feel nauseous. But I just want the doctor to check on me.
Okay. So I'll check your vital signs.
Okay.
Your blood pressure is normal, 120/79.
Okay, thank you.
So now I will check your temperature. While waiting for the temperature, Mrs. Moran, I will check your breathing. It's normal. Your breathing is 18 breaths per minute and it's normal. Your temperature is also 36.8, which indicates it's also normal.
Okay.
So the last two vital signs are, I'll check your oxygen saturation. It indicates here 98. And also, last one is your pulse rate. Your pulse rate is 72 beats per minute. Mrs. Moran, can you tell me about your past health history?
Okay. I have hypothyroidism. I also have, of course, my vertigo. And the doctor told me I have borderline diabetes, which he told me I don't need medications for that, only exercises and diet. And I guess that's it.
So what usually triggers your vertigo attack, ma'am?
I think it's every time I don't sleep enough, so I guess lack of sleep, and when I get so tired, and sometimes it just comes on without any notice, just sudden.
And also, ma'am, what do you usually do when you have the vertigo attack at home?
I usually do only bed rest. Yeah, and it helps me.
When you mentioned your past health history, ma'am, what medications do you usually take at home?
At home? Oh, at home I take Euthyrox 75 micrograms every day. And I also take calcium tablet once a day. I take vitamin C. I also take some supplements like Silver Advanced Vitamins Syndrome.
Okay, thank you, Mrs. Moran. Let's proceed to gynecologic and obstetric history. Do you have any?
I have no problem with that. I had no history of pregnancies, and now, I'm already 67, so I have no problem with that at all now.
Also the family history, ma'am. Can you tell me something?
Our family history, in our family we had, I have sisters, actually 3 of them, who already died of lupus. My mother died of stroke. My father died of lung cancer. Yeah, that's it. So
What about-
hypertension.
Okay. What about the psychosocial history, ma'am? Do you have any issues?
No, I'm fine with that.
And your current lifestyle? Are you doing gardening or something?
Since I am already retired, I spent my time mostly at home. I love gardening, so I have a lot of orchids. I do gardening every morning, and I listen to music, and I spend sometimes I go out with my siblings, and occasional shopping.
I can really tell that you're having fun.
I am.
We're all done with the assessment, Mrs. Moran. So I wrote here the reason why you came here in this hospital is because of vertigo last night.
Right.
And you have medical history of hypothyroidism, vertigo, and borderline of diabetes.
Okay.
And your family has a history of lupus, lung cancer, and stroke. Is this
Right.
correct, Ms. Moran?
Right.
So the doctor might order some laboratory tests, or he might order some medications for you.
Okay.
And just a reminder, Ms. Moran, that when you have the vertigo attack at home or anywhere, make sure you sit down and hold on to something sturdy, especially when you are alone, because there is possibility of falling. And
Okay.
also, if possible, you should have always somebody with you, just in case the vertigo attacks happens at any time or any place. We'll
Okay.
never know.
Okay, thank you.
Do you have any clarifications or questions about the assessment, ma'am?
No, everything's okay. Nurse
Yes, ma'am.
Stella, is the doctor already here?
He's with another patient, ma'am, but he'll be here shortly.
Okay, thank you.
Thank you for your time, ma'am, and thank you for sharing your information with me. And you can sit here while waiting for the doctor.
Okay, thank you, Nurse
Thank
Stella, for your time.
Thank you. After assessing the patient, we need to perform the hand washing again.